We are joined first today by Associate Professor of Bioethics at Oakland University's Beaumont School of Medicine. Dr. Jason Wasserman joins us once again on the Oakland County Megacast. Dr. Wasserman, thank you for being with us today.
Thanks for having me back. It's good to be with you.
Appreciate having you on. How have you been since we last spoke?
Well, like everybody, cooped up in the house, but we're doing our best and trying to, as you mentioned, get ready for the fall semester, which is going to be unpredictable, and it's taking quite a bit of work to plan for the various contingencies. But I'm excited to welcome our medical students back, whether that's obviously going to be mostly virtually, but great to get a new crop and start to think about generating more doctors for the state of Michigan.
And it's interesting, too, because teaching students in many other degree programs is certainly different than teaching students in a medical program in regular times. In times like this, what new challenges does that present to people like you and other associate professors and professors in the William Beaumont School as they're trying to teach these budding medical professionals to be great medical professionals, hands-on medical professionals, while we're all at a social distance?
Yeah, so common misconception is that a lot of what we do is just pump their heads full of facts about the human body and pathophysiology. And I'd actually say that whilst that's a significant part of their learning, just as important is how they learn to work together, how they learn to be professional. So to be a physician and all of the sort of norms that entails and the way one sort of approaches one's craft. These are things that you learn by being present with other professionals, by working with your colleagues closely. It's what we call cognitive apprenticeship. That's sort of absorbing all of the, we used to call them soft skills, but I hate that term. But all of the sort of norms and patterns and habits of being a professional, and it's going to be quite challenging to replicate that. We're going to try to do a lot of virtual stuff like we're doing now. So you and I are interacting, albeit it's not quite as high quality as an actual interpersonal interaction. But we're going to do what we can, and we're going to hope that sooner rather than later we can it'll be a new normal, but we'll get people sort of back together and start to really ramp up all that teamwork, relationship building and community building that we really pride ourselves on at OUWB.
Professor, do you think going through a pandemic, actually living through it, can enhance their education in a way that they wouldn't experience otherwise?
I do, yeah. And this is a question. I did some sessions for students from around the country and around the world, actually, for the Arnold P. Gold Foundation on humanism in medicine. And some of what we talked about, those students came from Ireland, and they were in Singapore and the United States and Canada. And to a student, they really felt like, wow, there was tremendous downside to the pandemic, particularly in terms of most of them had been pulled out of their clinicals by and large, and they weren't getting the kinds of experiences that they had hoped they would be having. They also spoke about this sort of new awareness that they had. They spoke about feeling deeply committed to the profession of medicine, of wanting to, of one of the things they realized when they were pulled out of clinicals was what they really wanted to do is be able to help, and they felt helpless, and that feeling has stuck with them, and many of them, they went out looking for opportunities to get involved. And what I hope is that in some way, not just the pandemic, but the new attention to police brutality and racial inequalities in health, all of these things is going to create a new generation that is particularly mindful of what's happening at a macro level with health, at a political level with health policy, and thinks very deliberately and critically about what their role is in shaping all of that.
Dr. Jason Wasserman with us. He's an associate professor of bioethics at the Oakland University William Beaumont School of Medicine. So as we're continuing forward, Dr. Wasserman, we've seen some issues in recent weeks regarding testing of COVID-19 in the state of Michigan. Some backlogs of cases as more testing comes into these independent labs that are usually a little bit slower than hospital labs or county or state labs necessarily are, and they had several backlogs, which led to which led to a delay in results being relayed to the state of Michigan and then to the public. So as we're going forward, and we've brought this up to physicians we've spoken to, should there be a priority in who is getting tested and whose results are coming forward first? Should it be those that are at risk of infection or at a higher risk or have been exposed potentially to COVID-19 before someone that's casually going in an abundance of caution and saying, I'm getting tested just because I'm curious if I'm asymptomatic or not?
Yeah, I think that makes sense philosophically. Putting it into practice is a bit more challenging. Now, there's big cuts that you can make to prioritize people. So rapid testing for healthcare workers is obviously something that you can do relatively easily. You can identify who those people are and create better pipelines for them to get testing. I think we've done that by and large. And that's important because a negative test for a healthcare worker is one more person back on the front lines helping us in this pandemic. And so getting that information sooner is better. When it comes to trying to identify, who to test in terms of, well, I have a large family or I'm in a high density residential neighborhood, I think that's a lot more challenging. And I think it makes sense to put our resources where they're going to do the most good. So I would want to test higher risk people, certainly, and some of that is identifiable and some of it's not. I want to test people who put others at higher risk to a greater degree. That's hard to determine. But I think philosophically that's fair. Practically, it's a little bit more difficult to carry out. There's some simple ways to do it, but I think we're probably going to be limited to those.
There is such a big debate across the country right now and here in the state of Michigan about whether or not kids should go back to school. It's one thing when we're talking about college students, but when you're, 8, 9, 10 years old, it's hard for them to socially distance. It's hard for them to keep a mask on. Should we be putting them back in the classroom, in your opinion?
Yeah, I have an 8-year-old, and so this is something my wife and I pay particular attention to. I think that one of the challenges is going to be that we probably do need some state and district-wide policies, but different schools are different age groups are different, and it's important to consider that. The question about whether we should or shouldn't, I think, is complex. I think it depends on the specific situation that they're returning to. My 8-year-old's school has a plan in place that I'm particularly comfortable with, which includes almost exclusively outdoor schooling, ventilated outdoor tents, mandatory mask wearing, and temperature checks for all the kids as they come in. The classes are small, and they've measured, and they think that they're going to be able to whatever extent you can, properly mitigate the risk. And we'll see how it goes. But, I think that they're doing everything right and doing what they can. But that school has advantages that not all schools have. And I would be concerned about a higher density school population. I'd be concerned, but I'll tell you this. One thing that I think we can all particularly invest in is following through on the kinds of protocols that are laid out in the state plan, that are being laid out by the CDC. And I think the biggest risk that we face is, especially the biggest modifiable risk we face, are people that are, resisting those basic, simple measures. I see on forums parents objecting to having their kids wear masks in schools, and that's going to be our downfall. I think that, the plans are what they can be, but it's up to us, all of us collectively, to execute those plans, to put aside the conspiracy theories about CO2 buildup in masks, which is absurd. These masks are not going to make your kids woozy. That's something I heard. If masks made people woozy, surgeons would have a really tough time doing their jobs, and they don't. So I think, the plans are going to be probably as good as they can. There's some circumstances at a number of schools that are going to be really challenging. But what we should focus on is all coming together and making sure that we execute those plans as safely and as thoroughly as we can.
I will say I haven't heard that theory about the mask yet, so that's a new one to me, and I thought I'd covered a lot of them. So do you think the kids need to be tested prior to going back to school? But then we're even seeing in situations like professional sports where they're negative on Monday, Wednesday, but then positive on Friday. So it's a snapshot in time. Would that even be effective?
I don't know. I would leave that to an epidemiologist to tell us about the value of comprehensive testing. Certainly kids that have, some reason to believe they've been exposed or have family members that are at risk, it would make sense, I think, to test them. I think the temperature checks, are a good idea. A lot of what we're seeing come out of, from the data from summer camps that were open and the data from schools in other countries that opened as the virus subsided is not promising. So I'm not sure that, comprehensive testing is the right way to go, but certainly testing, strategic testing probably is a good idea.
Dr. Jason Wasserman with us. He is an associate professor of bioethics at the Oakland University William Beaumont School of Medicine. Dr. Wasserman, as we're getting further along in vaccine trials, many vaccines now are in phase 3 of their trials, and we're really rushing toward, and rushing's not the best word to be using necessarily, toward finalizing these vaccines, and hopefully sooner rather than later, having a vaccine that is effective and is safe and that can be then distributed to the public throughout the world. But as we're approaching that from a bioethical standpoint, how ethical is speed? To what extent is speed of these tests and getting a vaccine available still within the realm of being ethical, and where do we draw that line where, well, we could take a little bit longer, be a little more thorough, or we can get it done as soon as possible, know it's mostly safe, but get it out early for the good of the public health?
Yeah, I'm not sure we should be making that choice, because I think that what we should be doing is investing really heavily in quick and thorough development. So all of this is much of the tension between speed and efficacy and safety is really a resource question. And if we invest in properly in vaccine development, I think we can move forward more quickly. That doesn't, but you're correct that we should not be sacrificing safety and efficacy for speed, where we might have to make some choice about that. I think that's particularly important for a couple of reasons. One is, from an ethics standpoint, from a public health ethics standpoint, there are other ways to mitigate the risk of coronavirus. And if we, as a society, were doing a better job following best practices, we would not be at, the effect and need of a vaccine would be far diminished. Two is that there's a long-term consequence of putting out a vaccine that's has limited efficacy, or especially that has any kinds of safety questions. If you pay attention to the vaccine debates, people who oppose vaccines, who are vaccine deniers or vaccine hesitant, commonly cite all sorts of statistics about side effects of vaccines. Most of these are false or exaggerated, or they come from self-reported databases, which means that people can go in and self-assess whether the vaccine caused them any problems. It's not reliable. But the last thing we want to do is fuel that with a new vaccine that has real challenges in that regard. I think it's I know that there's a short-term goal here of getting the coronavirus under control, but we got to pay attention to the long-term consequences of doing a vaccine the wrong way. And I'd rather see us do it the right way.
As a professor of bioethics, what have you learned from this pandemic, and what concerns do you have going forward?
Wow. It's a big question, because like everyone else, I think I'm learning quite a bit about how we function as a society, what our shortcomings are with respect to public health infrastructure, with respect to economic infrastructure. I think we've learned a number of things. We've learned to some extent we weren't as well prepared as we should have been. I think we learned that stricter measures early would have been a better way to confront the pandemic when it first began. These things are pandemics or infectious diseases are spread exponentially. So if you can cut it off early, it pays manyfold down the road. I think we learned that lesson, and unfortunately, we're still learning that lesson. now, as we see, especially in the South and the West, rates of the virus, really dramatically higher than they really should be. I think we learned a lot about how the complexities of fairly distributing scarce resources. So as we started to try to plan for scarce resource distribution, running out of ventilators, for example, we started to confront inequality in health in our society in an even greater way. We realized that if we base, for example, who gets a ventilator on comorbidities that they have, that's unfair because different populations are affected differently by health and illness in our society. African Americans, for example, are experiencing rates of coronavirus that are much higher, so inequality is paying itself forward even as we try to respond ethically to the pandemic. So I just, I think the lesson.
We apologize, Dr. Jason Wasserman. It looks like we've had some technical issues on our end. We'll have to cut your interview a little bit short. We appreciate having you on. Jason Wasserman, Associate Professor of Bioethics at the Oakland University William Beaumont School of Medicine.